Welcome to the presentation for Module 2. This presentation is going to discuss care of patients with HIV. So HIV stands for Human Immune Deficiency Virus. Basically, it's talking about a virus that's kind of a tricky virus. It's called a retrovirus. So basically what that means is that it has the ability to infect a cell and kind of invade that cell like a parasite. And as it takes over that cell, infects that cell, it repeats the cycle and essentially just replicates itself. So the HIV cell has found that it really likes to attack the CD4 cell or the T cells. And those are those specialized white blood cells that we have that are part of our immune system. They're part of our cell mediated immunity. So if the HIV virus is able to attack these cells and kind of take them over, and then it kind of replicates HIV virus, and so that means that we're not making more CD4 cells, so we don't have the immune system or the immune ability of these CD4 T cells. So that makes a person immunocompromised. These are the top 4 ways that HIV is transmitted. I think there's a lot of education issues out there regarding how this is transmitted. It is bloodborne, so it has to be it's usually in the blood, not typically in saliva. A lot of people have heard that myth, but these are the top 4 ways that it's typically transmitted. It used to be, it was thought to be like the homosexual community was the only people that get this. This disease was kind of found or identified in 1981. And initially it was thought to be just a disease of like homosexual males. We have since found that that is not true. Anybody can get HIV. And I think the most prevalent population now is heterosexual females that are getting this. So lots of myths out there about HIV, and one of the biggest things that healthcare providers need to do in the community is make sure people are educated on how this virus is transmitted. These are some diagnostic tests that you might see related to a person who is being diagnosed or has HIV. The lymphocyte count is doing that differential count of the white blood cells to determine if they are getting a low CD4 count. People with HIV will have a tendency to have a low white blood cell count, and then specifically they will start to get a low CD4 count. That's also, the CD4 count kind of determines how much of the virus the patient has present in their body. As they're being treated with antiviral medications, they use the CD4 count to kind of determine how well the medication is working. So if the CD4 count is really low, that means that the medication is not working well for them. The ELISA and the Western blot are diagnostic tests used to determine if someone has been infected with the HIV virus. They're antibody tests. Basically, when we are infected with the virus, our body starts to try to build antibodies for this virus. So that's what this is looking for, whether we have the antibodies or not. The thing about this is, as soon as you're infected with HIV, you may not show the antibodies for a couple of weeks down the road. Typically, your body doesn't build up those antibodies enough that it's detectable for a couple of weeks. So someone could be infected with HIV. One day, if they took the ELISA test the next day, they might not show positive. So ELISA is the first step in testing someone for exposure to HIV. It's inexpensive, it's accurate. So basically, it's something we can do pretty easy. So we do that first. If they've been found to have the antibodies to the HIV virus, if it's a positive ELISA, they will go ahead and do the Western blot test as a confirmation. So if those two are positive, then the patient is diagnosed with HIV. So both of these tests, the ELISA and the Western blot, have to be positive to be diagnosed with HIV. And The ELISA is first because it's the most cost effective, and then the Western blot. If the ELISA is negative and someone really fears that they have been exposed to HIV, they will actually maybe a week down the road do the ELISA again to determine if maybe they tested them soon before they started to show the antibodies. And both of these tests are blood tests, so they'll have to have a blood draw they'll have to get a blood sample in order to have those tests done. Viral load testing is also kind of to determine how much of the virus has infected the patient. So, and it's also kind of used to determine how well any antiviral meds are working. So viral load, what we're looking for is a low viral load. We want it to be low. So you want your CD4 count to be high, your viral load to be low. That means that the patient is doing well, even though they've been exposed to HIV. And then that's the way we kind of monitor how well their antiviral medication is working. Normal CD4 count is 500 to 1500. So once it gets down to like 100, then the patient will be looked at to determine if possibly they have been progressed to AIDS. So we'll talk about that in a few different slides about what identifies someone as having HIV positive and what identifies as someone having AIDS. So the CD4 count and the viral load is part of that diagnosis of AIDS. Normal viral load would be almost zero. So if hopefully the viral load is very, very low. Most people who are not HIV infected should have a zero viral load. This is first of a couple of pictures that I put in here that show how a CD4 cell is infected with the HIV virus. It's kind of hard for you to read, and I apologize for that, but it's numbered here, so this is kind of the progression 1, 2, 3, sort of how it breaks in. The virus breaks into a CD4 cell, and eventually over here starts to replicate and break off and form an HIV viral cell. So the important thing to understand, even if like you can't read all these processes over here, the main thing to understand is that there are several pieces where this process occurs. So the reason that it's important to understand that is because the medications that we give them are meds that are thought to stop this process. So we have meds that we can give them to try to stop it here. We have meds that are designed to stop it here. We have meds that are designed to stop it here. What happens is we give a patient with HIV who is taking antiviral medications, they're going to take a cocktail of meds. And these cocktails usually consist of something that stops the virus here, stops the virus here, and stops the virus here. We're trying to stop this replication, this taking over of the cell in several different areas. So if we can stop it in these areas, if maybe we don't get it here, if we can at least stop it here, hopefully we can stop the replication of the HIV virus. So this is just another picture. This is a little bit more clear of how this all works. So again, it's showing the HIV life cycle. It's showing how it comes in and enters the cell and then joins with the DNA and the RNA and replicates and then eventually comes out with an HIV cell. So these are the names of a lot of the meds that we use. Hopefully you'll see these on your module outline: the protease inhibitors, the integrase inhibitors, the reverse transcriptase inhibitors, fusion inhibitors, and the entry inhibitors. So again, like I said, a patient might be on one of these, one of these, one of these, all together, and that's why they have to take a cocktail. We are trying to stop this process. And so it's important for us to educate patients on why they have to take so many, because a lot of them have some side effects, and it's hard for the patients, and they're expensive. A lot of these meds are expensive, so and that's if we can get them on a good cocktail that works to stop the replication and stop the invasion of their CD4 cells, then their CD4 cells will stay normal, which is 500 to 1500, and then their viral load will stay very, very low. We want it to be almost nothing. So if we can get somebody on a good cocktail to stop this replication, to stop this invasion of the CD4 cell, they should continue on having a decent CD4 cell count with a low viral load. That's our goal in antiviral therapy. This again is just another picture that I found to kind of help you understand how these drugs work. Same concept. Just, we're trying to stop this whole crazy process. This HIV virus is very tricky. It's found a way to kind of dig itself into a CD4 cell and just take it over and then replicate itself as a viral cell. One thing, like I already kind of said, is these meds are expensive. Probably the biggest challenge for healthcare providers is to make sure that patients are compliant with these. They have to take these as prescribed. They should not skip around. They shouldn't take, just take it in the morning but not in the evening. Because what happens is this cell can kind of find a way to get resistance to these drugs. Because what happens to viruses and bacteria, over time it can build up a resistance to these. So that's why if you've heard of people, if they don't take all of their antibiotic therapy, that they can actually open themselves up to opportunistic infections, and the germ can actually kind of find its way to be not sensitive to these meds. That's how we end up with like MRSA and all that stuff. So that's what we're trying to avoid with these antivirals as well. If people don't take it as prescribed, they open it up for this virus to kind of become insensitive to them. So patients have to take them as prescribed. There are some side effects that they're going to have to deal with. I mean, it is what it is. They try to get them on a good cocktail that they're happy with. We have to make sure that we get them help so they can afford this. Once they've been diagnosed with HIV, they need to take this for the rest of their life. And that's where we are right now. There's a lot of research out there trying to find better ways to treat this, but for the most point right now, once they start these antivirals, they're going to take them for the rest of their life. So that's a big expense. It's a big commitment. So that's what a lot of the education and support that these people are going to need. Because one of the other things to make sure that we verbalize to patients and talk to them about is that these meds are antivirals. So what these do is they inhibit the viral replication. They do not kill the virus. The patient still has the virus, but we are containing it with these drugs. We're keeping it from replicating itself. Again, like I said, we treat them with cocktails. It's a multiple drug regimen, and they're a combination of all these antiretrovirals. The term HAART, which is HAART, has been kind of coined to describe these drugs, and that stands for highly active antiretroviral therapy. And this is what so far has been showing good results in most patients who are compliant. There is a nursing safety priority drug alert on page 371 in chapter 21. Just talks about how all of these drugs need to be taken as ordered. Teach the patients the importance of taking their drugs exactly as prescribed. Even a few missed doses per month can promote drug resistance, like I was kind of talking about. So, real important education point for patients on antiviral meds. Okay, I kind of mentioned before that there is a difference between a patient having HIV and AIDS. So, HIV is just saying if they're HIV positive, they've been infected with the virus. AIDS has a different criteria. This is typically someone who has progressed the HIV virus has continued to infect the CD4 cells. So they will have a low CD4 count and a high viral load. So that means that the virus has been successful in taking over their CD4 cells and increasing the patient's viral load. There's lots of different tables on other charts, I guess, on page 364. Really important, kind of nice little reminders about HIV. So there's 3 different charts, 21.3, 21.4, and 21.5. And then the real important one is on page 365, chart 21.6. It talks about AIDS. What is are the key features of AIDS? Typically, someone is diagnosed with AIDS if they have a low CD4 count, usually less than 300, and then a high viral load. And then the other piece of that is an opportunistic infection. So basically what this is, and there's a list of these opportunistic infections on 365. Some of the most common ones that you'll see are the pneumocystitis, pneumonia. That's a common one. Fungal infections are very common. Kaposi sarcoma is the one that you see a lot. Not as much anymore, but we used to. It's kind of those blotchy spots all over a patient. If you've ever seen the movie Philadelphia with Tom Hanks, they did a really good job of having those appear. And I think it was kind of like a dramatic little scene in the movie where he shows all of the blotches all of them. That's Kaposi sarcoma. So basically what these are like germs that exist, diseases that exist that all of us with a normal immune system have the ability to fight against. But a person with a immune deficiency such as HIV and AIDS, these opportunistic infections will just fly in and attack them. So typically that's what happens when someone has AIDS. They have such a low CD4 count, they have such a low immune system and a high viral load that they cannot fight off these opportunistic infections, and ultimately that is what might be give them a poor prognosis, is that they are so open to all these opportunistic infections that are very deadly. Some of them are. So just make sure you have an understanding of if someone has HIV positive, it doesn't mean they have AIDS. AIDS is kind of, the way I describe it, is when the disease of the virus has progressed to the point where they have low CD4 count, which is usually less than 300, a high viral load. Make sure I say that right. High viral load. So that means the virus is just going crazy in their body. And then an opportunistic infection. And that is usually the definition of a patient with AIDS. The HIV virus can, over time, take a toll on the body. So this is just a pretty good picture. I like this picture. It kind of shows you all the different things that can occur in the body, especially with somebody who's kind of progressing to AIDS. One of the things that I've seen in a few patients with HIV is this neuro changes they do. They can get like an AIDS dementia complex and get very confused and kind of have a change in mental status and things like that. And this is just the virus taking over the body, and the body's kind of having a hard time fighting it, so it just doesn't work as efficient as it should. Again, there's that pneumonia that I was talking about. That's a common opportunistic infection in a patient with HIV. So just kind of read over this. Your book does a good job of talking about all the things that can happen to a patient as the HIV kind of attacks its body. Then one of the main the points to understand too, is that somebody with HIV needs a lot of community support. They need, it's something that they're going to have to follow up with a provider for the rest of their life. And really kind of, they're going to be at the doctor quite a bit, making sure they get their medications, making sure the medications are doing their job. So it's a lot of follow-up. So they need a lot of support and a lot of community resources. Support groups are great, so they can, network and communicate with other patients who are HIV positive to kind of cope and understand how to not spread the disease if they want to have relationships in the future, there's a lot of teaching that needs to be done so that they don't transmit the disease to somebody else. That concludes this presentation on HIV for Module 2 in Nursing 150. The only other comment I did want to make is on page 372 in your IGGY book to 374 is a lot of HIV meds that are discussed. It's like a chart for the HIV meds. You'd have a list on your module outline, so kind of make sure you find those in the chart and look at any certain nursing interventions that might be related to that med. Some of them, have some liver, it kind of affects your liver, so the patient needs to make sure that they're not drinking a lot of different things like that. So kind of familiarize yourself with that, and we'll talk about that a little bit in class as well.